Okay, here we go. Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us today.
Hi, good afternoon.
Good afternoon. My name is Dilshad Berman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, the way it goes is we've been collecting your questions all week for the doctor. She's never seen them before, and she's going to answer them off the cuff. If you haven't had a chance to submit your questions, whether via our social media or on our website, you can still do so in the live chat in this broadcast, and we'll try and take as many questions as we can in this short 30-minute period that we have with the doctor. How this normally goes is we start off with vaccine and vaccine adjacent questions, and then we move on to the other questions. So that's what we're going to do today as well. Doctor, are you ready to go?
Yeah, let's go.
Okay, let's get started. We're going to start with Placettes' question. They ask, I heard the vaccine passport is only good for 6 months. Is that true?
No, that's not true. We actually don't know how long we're going to need the vaccine passport for. The idea behind it is we have it now while we're in the fourth wave to allow us to continue to keep businesses open and participate in activities. When we're out of the woods and don't need to have that certification process in place, then it can be removed. So, and we don't know how long that will be. It will be, we'll have to, the province will assess things as they go.
Right. And then Concerned asked, why did the Canadian government donate its Johnson & Johnson vaccine without providing it for use in Canada?
So I'm not sure why they did that. I'm not even aware that any of the doses actually made it to Canada for use. And I think part of it is based on supply and demand. And certainly we don't want to be in a situation in Canada where you end up with more vaccines than you can use, and then they end up being wasted. Once they come here, my understanding is it's very difficult to donate it. Mm-hmm. I think it's also important to know, I think some people really want the Johnson & Johnson because it's a single dose vaccine. But I think there is emerging evidence that will be coming that shows that even with the Johnson & Johnson one dose, a booster dose will be required. Right. And remember, the Johnson & Johnson vaccine is that viral vector vaccine. It's more like the AstraZeneca, which has that rare risk of those blood clots. And our messenger RNA vaccines do not have that risk.
Right, absolutely. Let's move on to Robin's question from Twitter. We had this question last week, actually, but it's good to reiterate. What is being done to help those with severe needle phobia? Some people need to be knocked out completely to get the vaccine.
Yes, I mean, I think some of the people who haven't been vaccinated yet, it's not because they don't want the vaccine, it's because of that concern about the needle. Mm-hmm. And I think there are a number of things, we talked about this last week, but I was thinking about this further. Like, I think we really need to reassure people that you are not alone. I mean, up to 10% of even adults have needle phobia. A lot of the COVID vaccines are available in doctors' offices. And I think that may be a more comforting place to get the vaccine than, say, going to a clinic that you're not familiar with. Yes. Even a local pharmacy may be a place that may be more comfortable for you. I think it's about putting everything in place to help you get vaccinated. And so if it means putting a numbing patch on, making sure you have it on the right place in time, preparing yourself. Distraction is often quite helpful. So if you're, on your phone when you're getting the needle, having someone talk it through with you, maybe having a friend or family member there with you to get the vaccine, lying down as well is another really good measure. And I think also being reassured that many people, like you shared yourself as well too, Dilshad, who have this can still get vaccinated. You can still overcome it.
Yes, I think my needle phobia is, I think you understand that it's irrational, but it's still there. And so I sort of powered through it. I did a lot of the things that the doctor mentioned. I had the numbing cream. I had a friend hold my hand. My boyfriend came with me. The nurses, whoever was sort of administering the vaccines, were very kind and very understanding. And they do take their time. They're not in a rush. So all of those sort of things helped me get through it. It's still not a pleasant experience, but there are definitely ways, if you have this sort of extreme needle phobia, to get through it and get your vaccine for sure. Doctor, speaking of which, there was some talk recently on either social media or elsewhere that they were looking at oral vaccines, like the polio vaccine was drops. Is that a possibility for the COVID vaccine?
I mean, anything is a possibility with science, but I'm not aware of an oral vaccine being very close to being approved.
Right.
We have, so I don't think that it's something that you should wait for to say, okay,
Right.
it's coming, I'll wait for that. Yeah.
Right. Okay, that makes sense, because I would have waited. I would have 100%. I'm so scared of needles. I would have.
You know, the other thing to say to someone who's needle phobic is this vaccine is a very small dose compared to, say, a flu shot. It's actually even smaller dose. And so by the time, I actually find when you vaccinate, by the time you inject, you're out again. Like, it's actually very, very quick, unlike even other vaccines or giving blood situations that you may have had before.
Right. Yes. That I feel like that's correct, because, well, it is correct because your doctor is telling us. But when I had a tetanus shot, it was very different from getting the vaccine. The vaccine was sort of in and out, and tetanus really felt like it's stuck in there for a while. So for sure, I feel like that comparison is rings true for sure. Okay, let's move on to our next question. Willie, again from Twitter, asks, I have taken a double dose of the AstraZeneca. Does my proof of vaccine allow me to travel by plane to the US?
So right now, the answer is yes. We're hearing that the US is coming out with vaccine requirements, but they haven't released what those are. I mean, I just know what you know in the media reports. And so they haven't quite clarified what those will mean.
Okay. WD asks, what does it mean when it says vaccination status unknown? And how can there be over 100 people in Ontario hospitals with this status?
Okay, well, it means that they don't have confirmation that the person is vaccinated. And that means in that provincial registry, there's no sign that they're vaccinated. They also don't have the person confirming that they're not vaccinated. Now, the large majority of people who have unknown as their status are most likely unvaccinated. But because there isn't that confirmation, there is a small chance that they could have been vaccinated in another country, for example. But most people who are vaccinated in Ontario, it is in the registry. And so unknown usually means that they're unvaccinated.
Okay. And then Val has an interesting question. I haven't come across this before. Would a vaccinated person's body reject an unvaccinated person's transplant organ? Why else would they not let unvaccinated people be transplant donors?
Okay, I'm not aware of the transplant service requiring vaccination in order to accept donations. I'm not aware of that. I can certainly look that up for next week. We do know that COVID can affect your organs. And I think the real risk in transplant is it's not just COVID, it's other viruses or infections that you could have. You could give it to someone in a transplant. So some of the bloodborne infections like hepatitis B or C or HIV, that's part of the restrictions in people who have infections. Now, what you're asking about is someone who's unvaccinated. And so I will have to look that one up. But certainly if you have an active COVID infection, you wouldn't want to transplant that organ because you would essentially most likely be giving COVID to whoever's getting the organ.
Right, that makes sense, right. And then Barb asks, this is interesting, and I've seen this around on social media a lot. Why do we keep calling it a vaccine when it is gene therapy?
So it's actually not gene therapy. It doesn't in any way interact or combine with your genes. Your genes are essentially your DNA, your body's own DNA. And the messenger RNA vaccines, this is the nucleus where your DNA is inside the cell, and the messenger RNAs don't go inside the nucleus. They have coating that then your body reads and produces proteins and antibodies as a result of it, but it does not interact with your genes, and so it actually is not gene therapy. The reason why we call it a vaccine is because we give it to you before you are infected to mimic an infection and to get your body's immune system primed.
Right, okay. And then let's move on. Dawn asked, why do vaccinated families get to go for in-person dining with their children under 12 who are not vaccinated?
Yes, well, I mean, there's no vaccine available for children who are under 12. And so we're seeing that even going to some of these sporting events, for example, participating in sports, being a spectator, they are exempt because of their age. We do know with children that for the large part, most children are getting COVID from their close contacts, predominantly in the household. So parents who are unvaccinated, other people in the house who are unvaccinated, getting COVID and giving it to children. That is the commonest way that children are getting COVID. Right. And so by having parents who are vaccinated, it actually lowers the risk substantially, even for those unvaccinated children.
Right. Let's go to this live question that just came in from Joe. Why are vaccinated people not allowed to donate blood plasma? I'm not sure if that's accurate.
I'm not sure if that's accurate either. So let's hold on some of these blood plasma, organ donation, and I can certainly look it up and share what we find next week.
For sure. We appreciate that, Doctor. Thank you. Okay, let's move on to some more questions coming in. Dawn and Carol actually have a very similar question. So I'm just going to ask Carol's. Why do unvaxxed people need to get a rapid test to protect people from COVID when vaccinated people can also get COVID and spread it, but they don't require rapid testing? I'm assuming for access to certain things.
Yeah, so the rapid testing is certainly not a routine part in general, like going to a sporting event. It's actually now just vaccinated only. I think some workplaces may have policies where if you're unvaccinated, you then have to do rapid tests. The reason why it's for unvaccinated is because if you're unvaccinated, you still have a much higher risk of getting COVID, 5 or 6, 7 times more likely to get COVID compared to someone who's unvaccinated. And so because the risk is higher and because you don't have protection if you were exposed, that's one of the rationale for having that rapid testing being used in that circumstance.
Right. And Doctor, you just mentioned, the chances of getting COVID are higher. Rose has a related question. She says, a nurse told my sister that since she was double vaxxed, she was 65% more prone to getting COVID. I don't believe this is true, and it's irresponsible to say because she's a health professional, but can you confirm this?
If you are double vaccinated, you are not more likely to get COVID. No, in fact, you're more protected. So maybe it came out wrong. What we know is that people who are unvaccinated are 5 to 6 to 7 times more likely to get COVID. So if you're vaccinated, you're that much less likely to get COVID.
Right, absolutely. And then a related question to the carrying of COVID and transmitting COVID. CJ asks, people with the COVID-19 shot can still carry COVID-19. How can we say that COVID-19 shots will protect us from the virus?
Okay, so there's no evidence because you're vaccinated that you're carrying COVID everywhere you go. That's not how it works. What we do know, though, is the vaccines are there to prevent that severe infection, hospitalization, right? We know that if you're double vaccinated, you can still get COVID. And if you get COVID, you can still spread it. Right. Now, it's not clear if you're going to spread it the same as someone who's unvaccinated, but you can, because you get COVID, again, a milder illness, there is a chance that you can spread it. So it's only in those circumstances that you become infected.
Right.
Test positive that you are likely to spread it. And again, the chances of you getting COVID are much less when you're vaccinated.
Right, exactly. Okay. And then D asks, I got vaxxed, but I still have to wear a mask and do a COVID test when I'm traveling, etc. Please, can you explain why this is the case before I go and get my second dose? It's very confusing.
Okay, well, again, getting double vaxxed, waiting 2 weeks will give you the best protection. But we still know that the goal of the vaccination is to prevent you from getting very sick. We're not using the vaccine to prevent full-on transmission. What we want to do is reduce transmission, reduce the spread, so that we can keep the cases at a very low level. Again, preserve our hospital or our healthcare capacity. And so that's the reason why when we have COVID spreading, especially we know travel is one of our common risk factors for why people are getting COVID. They're getting it from travel. That's why you need to take those precautions when traveling.
Right. And let's take a live question that's coming in on YouTube from Adam. Why are we still using the PCR test when the World Health Organization has abandoned it due to false negatives?
So I'm not aware that the World Health Organization has abandoned it. The PCR test is still our best test. It's what we call a molecular test. It's a test that has to go to a laboratory in order to be tested. It is a much better test even than our rapid antigen tests. And so it is still our best and recommended test if you have a symptom of COVID, if you have been in close contact of someone who had COVID, even if you're vaccinated or unvaccinated, it is the PCR test that you should be getting at an assessment center, or if you are a student, from one of those take-home PCR test kits.
Okay. Okay, that brings us to the end of our vaccine questions. Let's move on to some vaccine-related questions. Wings asks, are there more details about hospitalized breakthrough cases, like their medical conditions or whether they're on a ventilator? Transparency will encourage vaccine acceptance, they say.
Yeah, good question. In terms of being on the ventilator, those who are vaccinated are very, very not likely to be in the ICU. In fact, I think there have been very, very few people who, if any even, I mean, maybe there have been some, but most people who are vaccinated do not end up in ICU. A small portion are hospitalized. And what we know about those people is often they are still our older adults. 80 plus, 70 plus, even 60 plus, it's age related. Some of that may be because of their own immune response. We know that as you get older, your ability to develop an immune response from the vaccine can be diminished. And so that's why we've started to see already, a booster dose for those who live in long-term care. And I'm sure more, as time goes on, there will be more booster dose recommendations based on the evidence at the time.
Right. Okay. Let's move on to this next question. Shan asks, the Covaxin vaccine in India, which I think is the equivalent of the AstraZeneca vaccine, they're looking into approving it for kids 2 and up. Is that something that Canada is looking into?
Okay, so the AstraZeneca vaccine, in order to be licensed for down to age 2, the manufacturer has to do studies to prove that it's safe and that it works, and it has to submit that package to Health Canada for approval. And I'm not aware that that has been done for that vaccine. I am aware that we've heard in the news, Pfizer has submitted their preliminary results to Health Canada for children down to age 5 so far. We know that Moderna has a big trials that they're doing in children as well too, so we can expect that vaccine as well to submit hopefully sometime this fall as well.
Right. Okay. And then this person's alias is Windy Bindi. Windy Bindi says her question is regarding COVID-19 at-home therapeutics. Given that both vaccinated and unvaccinated people can get the illness, why haven't home-based therapeutics been discussed? Early treatment has been extensively researched and tested worldwide, yet we don't really talk about this good news. And then she mentions there's a particular drug that she mentioned. Sorry, but that's the basic question: is why aren't we talking more about therapeutics rather than just vaccination?
So there certainly is ongoing work with therapeutics. I know different drug companies have different therapeutics on board. There's no evidence, though, that if you're at home with mild symptoms of COVID, not sick enough to go in hospital, for you to take particular, say, antiviral medication. Definitely do not recommend ivermectin. You may have seen some of the reports in Alberta with people using this drug there and have had more reports to the Poison Control Center. It is it can be a very dangerous drug when not used properly. And there is no evidence that some of those drugs like ivermectin help to treat COVID. So, again, until there is a drug that is available to give at home. Sometimes if people have trouble breathing, have a bad cough, you could use certain puffers have been shown to be effective. The Ontario Science Table regularly releases updates to their guidance on COVID-19 treatments based on the latest evidence for what has been approved and what has been shown to work.
Right. And then let's move on to Darlene's question. Darlene says, I was asymptomatic with COVID in December. If I have a breakthrough infection after vaccination, will I once again be asymptomatic?
It's hard to know, Darlene. What I can say is that if you get vaccinated, we know that the people who get vaccinated and get COVID are certainly getting milder infections. That's for sure. And so I can at least reassure you that way. You're less likely to get very sick for sure.
Right. But just because you had an asymptomatic infection previously doesn't mean it's going to happen again. It could be a whole different thing.
That's right. Even if you're vaccinated, there's no real way. I haven't seen anything to predict reinfections. What we are seeing is in the U.S., there's a growing body of reports, actually a lot of people who are getting COVID more than once, the reinfections. Right. So they may have had the Alpha variant and now they're getting the Delta variant. So that reinfection risk, if you stay unvaccinated, is still very real.
Right, absolutely. And then let's move on to Ali's question. Ali asks, where are people contracting COVID? Is there a large population that is contracting COVID through community spread?
Actually, the largest commonest reason why people are getting COVID is from close contact with someone they know who had COVID. Okay. Now, obviously, they didn't know at the time when they had that interaction that the person was contagious, but either in a household setting, in a social setting, they were with someone, they had that close contact, they weren't wearing masks, maybe they were indoors. That's the commonest way that people are getting COVID. Mm-hmm. Now, there is still, classically, it's between, say, 20 to 30% at any one time of people who can't quite pinpoint where they got COVID. And that's what we call community spread. And often it means that the person was out and about. That's what I say. They may have gone here, gone there, had a number of different interactions. Can't always say that they know who it was that, they heard afterwards got COVID. And can pinpoint where they got it from. And that's what we call community transmission. That still is not the predominant way, even with the Delta variant, for how COVID is spreading.
Right, okay. And then let's take a live question that's coming in from YouTube. Can you explain why we need 2 shots plus boosters and vaccine passports? When it was the yearly flu, we just got a yearly flu shot. It didn't require any passports or anything like that.
Okay, well, first of all, we're in a pandemic, and the flu, what we have for the flu, we've had a flu pandemic as well, too. What the pandemic usually means is that the virus is here, and there's no seasonality to it. It's here all year. It's a new variant of the virus. Nobody has immunity to it built in. And so, and it puts a lot of strain on our society and on our healthcare system. And so this COVID pandemic has carried on into the second fall again. And so that's why we call it, that's why it's a pandemic. That's how it differs from our yearly flu vaccination program. It hasn't become seasonal yet, though we are hoping that we will get there. And so right now, the 2 doses are providing very good protection for those who have received the 2 doses. It is those who are showing evidence for waning immunity, often because of their own immune system, that are recommended for the booster dose, but it's not everyone just yet. That's something that we're keeping a very close eye on.
Okay. And then a concerned citizen asks, last year, we saw that opening schools led to a spike in COVID cases. This year, even with the vaccine, it seems like cases are not that much lower, just in the community. So are schools still contributing to this?
Okay, actually, the school question is a very interesting question. We've actually now had schools open for well over a month, many weeks now, and we've actually seen that the case rates have actually stayed about the same, maybe even had a slight decrease. So that what we're very well aware of is that it's community transmission that often drives school cases. That's usually how students bring COVID into the school. It doesn't always spread in the school setting. So every person who has been at school while they were contagious does not always end up spreading it in the school. And that's because of all of, the masking and the cohorting that goes on in the school setting. So we're actually seeing an effect from the vaccinations affecting the community rates and likewise affecting the school rates. Now, this is something to keep a very close eye on, as we get colder into the months, as we go indoors, and to see the effects of school on our rates in general as well.
Right. And then part 2 of their question is, if we see exponential spread in schools, does TPH have the authority to shut them down again?
Okay, so, schools have been open again for many weeks. We haven't seen exponential growth, but again, what we're likely to see is first exponential growth in the community before we see it in schools first. That is the pattern that we've had, but we're looking at both metrics as well. Absolutely, when there is a case in a school, we do case and contact management. If there's an outbreak, we do outbreak management. Can recommend that schools be closed, can order that schools be closed if required. We work very closely with our school boards to, again, assess COVID and to keep COVID risks low in the school setting. But we don't always know what the future holds, but we will certainly act. Mm-hmm. Public health will act to prevent the spread in the future.
For sure. And then more kid-related questions. DMK asks, how many school kids 5 to 12 years old suffered from severe COVID-19 effects with no additional comorbidities in Ontario?
Okay, so in general, children get a milder case of COVID. We know that. Children are less likely to end up in hospital. We know that as well too. We know that if a child has a pre-existing health condition, that can put them at higher risk for getting very sick from COVID. But we also know that children who are otherwise healthy can get sick with COVID, and can get very sick from COVID. That certainly can happen. It is certainly less likely for younger children. But again, children make up, 11 and under make up 10-11% of our population, and that's a big part of our population that still are not vaccinated. And we're starting to see that the rates of COVID in our younger children who are unvaccinated are increasing more than in some of the other age groups. Right. And so, one of the ways to kind of end the pandemic is to get as many people vaccinated as possible.
Right. But sorry, doctor, coming back to the question in terms of numbers of school children, 5 to 12, do we have any age-based numbers in terms of severe cases?
That actually is available. It's available on the Public Health Ontario website, and the Public Health Agency of Canada also have this data available. In fact, even Toronto Public Health, we now have data specific to school-age children. So you can certainly look that up there, depending upon the time period that you're interested in. There has been, I just saw some of the data this morning, and 17 children in Canada have died from COVID. Now, I'm not sure how many of them had an underlying health condition.
Right. Okay. Let's move on to Jessica's question submitted over the week here. Jessica says, hi, Dr. Dubey, can you please give me more information on why we have such a lack of care for individuals who have tested positive for COVID? It seems to me that most of the times they're sent home with a wait and see approach until a number of them land up in hospital. And if we know that early treatment is available, why aren't we, using it or spreading more information about that?
Yeah, so that's a good question. In terms of early treatment, the early treatment really is while you have mild symptoms to treat your symptoms, like with over-the-counter medications, to make sure you're drinking plenty of fluids, getting rest, and trying to prevent the spread inside your household, like staying in a separate room. But also, though, to be kept a close eye on, because you can certainly turn a corner and get worse, and you want to make sure that you have access to healthcare in those settings. I know that there are some hospitals that have virtual care that's available for people who may be going home with COVID, for example. Using a pulse oximeter is sometimes also recommended that checks your oxygen sats. So I think wherever you are sick with COVID at home, find out what supports are available, including some of your family and friends who can connect with you virtually as well too.
Right, okay. Doctor, you just mentioned that 17 children in Canada have died of COVID. A live question on YouTube asks, how many of those children that died were vaccinated? Do we have that stat?
We would have to go back to check the website. I don't have that statistic. I imagine, if any, like it would be, yeah, I'll have to go back and check, right. But that is the full range of children, many of whom would not be eligible for vaccine. And it was from the start of the pandemic as well. So right. I have a long list of things to look up for next week.
For sure. Thank you, Doctor. Appreciate it. And let's go on to Cam's question. Cam asks, why aren't family doctors opening their clinics to treat patients? There are other issues and concerns apart from COVID that need immediate attention, and it doesn't help that the family doctors are only doing phone consultations and diagnosing patients without actually seeing them.
So I do understand that the Ontario Medical Association, Ontario Health have provided guidance to primary care providers on how to provide care during COVID, including in-person visits and how to do that safely. So there is more guidance out there to equip physicians to be able to see patients in person, because absolutely there's a really important, valuable role, and sometimes it can't be done virtually.
Right. And in terms of, I know we can't sort of mandate doctors to start seeing patients. So it's an individual clinic decision, though, despite the guidance and everything being in place.
Well, I think before it was considered very risky, like how do you manage with physical distancing and PPE? And I think now a lot of those guidelines have been sorted out. So, where you can provide care virtually, you can continue to do so, but where someone needs to be seen in person, there are guidelines in place to be able to do that safer. And so there is certainly a recommendation that primary care providers do provide that care, and some supports also available in terms of that guidance.
Right. Okay, doctor. And that brings us to 1 o'clock. Thank you so much, doctor, for your time and your patience in answering all these questions. Thanks to everybody that submitted live as well. If we didn't get to your question, I do apologize, but the doctor will be back with us next week and we'll try and get to them then. For now, we'll sign off. Thanks so much. Bye, doctor.
Bye.